The second lecture is about the assessment of cardiovascular system. طبعا بنحكي عن assessment, subjective, objective data, diagnostic procedure, and many things else. History. The very important symptom that we have to assess is the chest pain. The chest pain in cardiovascular diseases, especially like acute myocardial infarction, may be represented as typical chest pain like heaviness, tightness, squeezing, choking sensation that is located in substernal region and could be radiated to neck, left arm, back, or jaw, and lasted from 30 seconds to hours. The main cause mainly for chest pain in cardiovascular disease is the imbalance between oxygen supply and oxygen demand. So that our ultimate goal is to improve oxygen supply and decrease the oxygen demand for patients with cardiovascular diseases. Dyspnea is a subjective sensation reported by the patient in different cardiovascular diseases. Could be related to inefficient pumping of the left ventricle, decreased blood supply from the left ventricle to body part as in heart failure. Also among patients with pulmonary edema may lead to dyspnea. Also orthopnea, which is a difficulty of breathing while you are sitting or lying down. Paroxysmal nocturnal dyspnea. It's a dyspnea that occurs mainly 1 to 2 hours after sleep and relief by sitting position. يعني عادة تحدث بعد ساعة لساعتين من النوم وبتروح لما المريض يقعد ويسند ظهره على مخدتين أو ثلاث في الليل. Edema of feet and ankles also should be assessed because it appears among patients with heart failure, especially among patients with right side heart failure. The effect of gravity and the high venous pressure on the fluid movement from intravascular to extravascular spaces. This edema may worsen at day and improve at night because the patient may elevate his or her leg so that this will improve the venous return and the edema decrease. Also palpitation, which is a regular rapid heartbeat, could be skipping or rushing beat اللي هو بالعربي الخفقان. يظهر على المريض كأنه في تسارع في دقات القلب. Cardiac dysrhythmia, which is irregular rhythm in the heart and can be detected by ECG, electrocardiogram. This will affect the blood flow to the brain and may result in syncope or dizziness. Because there is an irregular rhythm, this will decrease the blood flow to the brain and may result in dizziness اللي هي الدوخة أو الغيبوبة السينكوبي لفترات بسيطة. Cough and hemoptysis should be assessed among patients with heart failure, pulmonary embolism, pulmonary edema, valve stenosis, and among patients taking angiotensin converting enzyme inhibitors like angiotic, which is the enalapril, captopril اللي هو الكابوتين. Nocturia also should be assessed. During the day, the heart unable to perfuse the kidney or to provide adequate blood supply to the kidney because sometimes the heart may be weak, damaged by acute MI. صار في جلطة قلبية عملت weakness في عضلة القلب وبالتالي the heart unable to provide adequate blood supply to all body parts. While at rest during the night, the kidney may receive adequate blood supply and sufficient blood flow so that the patient go to the bathroom many times. Cyanosis also should be assessed by pH discoloration on the labs, reduce O2 saturation and impaired circulation. Assessment of pain, claudication, paresthesia, pale, cold, atrophy. These are signs, symptoms for arterial insufficiency. Decreased blood flow to the body parts could be assessed by these things: the presence of pain, paresthesia, pale, paralysis sometimes, cold, and atrophy. Regarding the physical exam of the cardiovascular system, you have to go back to read the whole chapter in the physical exam book. لازم ترجعوا لكتاب الفيزيكال اكزام وتقرأوا عملية الفيزيكال اكزام الكارديك زي ما اخذناها بمحاضرات الفيزيكال اكزام. لكن احنا بنعمل هون الان مراجعة سريعة للفيزيكال اكزام. By inspection we can look for general appearance, self-care. Also we have to measure the jugular venous pressure, indicate also we have to look for jugular venous distension. Palpation of the pulses. There are different places to assess the pulse, to palpate the pulse. The degrees for the pulse: 0 could be absent or absent, 1 weak, 2 for normal, 3 for increased, and 4 for bounding pulse. In this picture we clarified the different places for the pulses. Here in the head, superficial temporal pulse, also external maxillary pulsation. In the neck, carotid pulsation. In the hands, brachial pulsation. Near the wrists, radial pulsation. The ulnar is deep. The ulnar artery is deep and couldn't be palpated well. In the leg, the femoral pulsation, and the popliteal pulsation, posterior part, the posterior tibialis and dorsalis pedis at the foot of